Hello, everyone. Welcome to HealthInfoNet's webinar on accessing HealthInfoNet's HINcontext to users' EHR systems, integrating the HIE within existing clinical workflows. We're excited to be sharing this with you all, our new HIE service that we've been working on over the last several months with our partners and participants. It looks like our attendee list has slowed down in the last few minutes, so we're going to kick today off. So my name is Chad MacLeod. I am the Manager of Product and Communication at HealthInfoNet and have been working closely with our team over the last 6 months to help bring to market the application that we will provide an overview and demonstration of during today's session. Should you have any questions following today's webinar, please feel free to reach out to us using the coordinates provided on this slide, either directly to myself or to our clinical education team, which I will give a plug for again at the end of our webinar. So, during today's webinar, we hope to achieve the following objectives. First, to educate on the connections and services of HealthInfoNet in the Maine HIE, to provide an overview of the purpose and value of our new HINcontext application, to preview the application and to review some current and upcoming priorities and releases, to review implementation plans and next steps for interested HealthInfoNet participants, and also to provide information on education and training opportunities that we offer. So before we officially get kicked off, I should also note that all participants are muted for today's session. However, if you have a question or comment along the way, I invite you to add them to the Zoom chat window, which Nicole, our clinical educator, and myself will be monitoring throughout the session. We do ask that since this is a global webinar for all of HealthInfoNet's participants, that if you have specific questions pertaining to your particular facility, such as how the tool may look in your EHR environment, interest in learning more about how to implement the tool for your organization, and so forth, that you either directly message Nicole or I in the chat, or reach out to us separately after today's session, and we would be glad to schedule some additional time with you and your teams. Lastly, today's webinar will be recorded, and any materials we look at today will be posted to our website for your use and reference going forward. Before we dig in too deeply into the core content of today's webinar, a brief overview on HealthInfoNet and our connections and services will be given just in case it's helpful to have a little background on HealthInfoNet and what we do. So the first thing is a little bit about our organization. HealthInfoNet is the state of Maine's designated operator of its statewide health information exchange, HIE. The HIE is designed to link an individual's clinical information from unaffiliated healthcare sites to create a single electronic health record. So whether a patient is seen up north, down south, or somewhere in between, their important health information is consolidated in our system for their treating providers to use to better support and coordinate their care. HealthInfoNet is an independent nonprofit organization governed by a voluntary community-based board of directors, providing a number of health data-related products and services to our participating provider organizations, including most familiarly our clinical portal and real-time event notifications, as well as some public health reporting, predictive analytics and measures, and more. HealthInfoNet is connected to more than 820 provider locations across the state, including all health systems, acute care hospitals, and critical access hospitals, in addition to VA sites, federally qualified health centers, behavioral health facilities, laboratories, Maine EMS, and more. Additionally, through our work with the Maine CDC and DHHS for their COVID-19 reporting efforts, which we previewed back in May, we are also now connecting to the state's designated laboratory testing site, the Maine Health and Environmental Testing Laboratory, which will give us a much more comprehensive view into patients' laboratory tests and results, especially their COVID-19 tests. This connection should be established by mid-August or so, at which time we will be providing our participants with additional information on what that means and then how to also access that data within our tools and services. And these provider locations that we're connected to provide a variety of important data points on their patient populations, such as demographics, encounters, laboratory results, radiology reports, diagnoses and procedures, and much more. These data elements are provided to HealthInfoNet in real time at the point of entry into the provider's EHRs, and are subsequently provided back to our participating provider organizations seconds later for their use in their clinical workflows. In the demonstration that I'll be providing during today's webinar, it's this data collected from our participating provider organizations that we in turn process, standardize, and disseminate back to our authorized users to leverage through our suite of tools and services. I'll note, and we'll come back to it later, that on our clinical portal landing page, as well as on our website, we do host a data coverage report, which essentially provides a list of all of the organizations, parents and children that we're related to and that we have a connection or a relationship with, and the types of data that they provide to HealthInfoNet, and that which is therefore available in our systems. All right, so now let's talk about our new application and service offering. So HealthInfoNet is incredibly excited to announce the release of what we're calling our HINcontext application. We like puns at HealthInfoNet. So this application was designed and developed in partnership with the Chesapeake Regional Information System for Our Patients, otherwise known as CRISP, which is a regional HIE serving Maryland, the District of Columbia, and West Virginia. So traditionally, users of HealthInfoNet's clinical portal are required to log into a separate online user interface outside of their existing clinical workflows to retrieve critical information from the statewide HIE about their patients. With the HINcontext application, users can now receive specific information concerning their patients' medical histories from the HIE while working inside of their electronic health record technologies. This application has been flexibly designed to allow EHR systems to query HealthInfoNet's HIE database from within existing provider workflows and to return and display that data, that HIE information, in a fashion that's most convenient both for the EHR technology as well as for the provider viewing the information. The application is currently available to Epic and Cerner EHR sites, and in the future to Athena, Allscripts, and other EHR technologies. The application was recently released to all of Maine Health sites on July 21st, so just last week, and specifically to their Epic physician users, with plans to roll out the application to additional user roles about mid-August or later. And it is expected to be released to the Covenant sites early this fall. Additionally, we are working in having exploratory conversations with Northern Light at the moment on how to integrate the application with their Cerner system. The HINcontext application is the outcome of, as many of you know on the call, of many years of stakeholder feedback, and it marks a really important milestone for HealthInfoNet in helping to make comprehensive patient information more easily available in EHR workflows to providers throughout the state. And so when successfully deployed, we hope that this application gives our providers more time to spend with their patients, reduce administrative burdens and potential redundant testing, and then ultimately contribute to improved patient safety. For the sake of today's webinar, let's assume that your organization has contacted HealthInfoNet, worked with us to install and configure the application within your EHR environment, and are now up and running for use by your providers and medical staff. Now, because the HINcontext application has been designed to be readily available to authorized users within context of their native EHR technologies, each individual organization's help desk or IT team now controls the application's access and authorization permissions for its users. I say this leading up to the demo because this is a key difference between the application and our clinical portal, which currently requires users to contact our customer support team in order to establish new accounts and credentials, or they can enter a new user request through the clinical portal form. And so for that reason, within the application, any new user that's interested in obtaining the access to the HINcontext application can simply ask their local help desk or IT team for assistance in extending the appropriate permissions. Additionally, if the help desk or IT team has any issues or needs education or training opportunities, they can still reach out to our customer care team and we'll coordinate accordingly. Skipped ahead too much. There we go. All right, so where the application can be found within users' EHR workstations will vary depending on their organization's configuration of the application. But the premise here is that the application will, by default, appear in the primary window when searching for a patient within their EHR. So in this example here, which comes from Maine Health's Epic environment, you can see that we pulled up a test patient within Epic, which consumes about 3/4 of the window. And at the same time, the HINcontext application brings up the patient in the remaining 1/4 of the window. You can see that off to the right-hand side. Now again, just before we get into the demo, a little bit of background. It's good to know if you're familiar with our clinical portal, what's different. And that's because this application resides directly within the provider organization EHR And so there are a couple of nuances in the way that the data is returned, presented, and displayed within the application in comparison, again, to how you may be familiar through our clinical portal environment. First, as a reminder from an earlier slide, users can learn more about the data included in the HINcontext application by visiting our data coverage report to review our current provider connections and the types of data that those providers are sending to us. Now, in terms of exclusions to that list of data, first and foremost, to avoid duplication of the patient information displayed between an EHR system and the HINcontext application, the application does not display any information about the patient's healthcare activities at the user's organization. Instead, the application only displays information about the patient included in the HIE that the user's EHR system may not contain. So, for an example, in Maine Health, if users are looking at a test patient within Epic, it will of course give them all of the information about that patient as it relates to the patient's visits at Maine Health facilities. However, the application will not display any information about the patient's activities at those Maine Health facilities. Instead, it might show you stuff that the patient's seen at Maine General or Northern Light or another facility that we're connected to HealthInfoNet. But again, it's trying to keep the duplication to a limit by showing you only the information that matters. Additionally, regardless of whether patients have opted in to sharing their sensitive information, their mental health information, with HealthInfoNet or providers, if they require that in the case of an emergency, the HINcontext application does not currently contain any sensitive information for patients. So if that information is needed by users in their clinical workflows, the clinical portal is still a use case to log in separately to view that type of information. Overall, to improve the performance of the application, it does not return a patient's full medical history stored within the HIE's 10-year repository. Instead, medications only look back for the past 120 days, which is consistent with our clinical portal. And then all other clinical data stored in the system only looks back to the last 2 years. So again, in the event that additional information is needed by users in their clinical workflows, the clinical portal can be used to obtain more information about the wanted patient. And lastly, a few patient consent nuances to consider. So first is that upon selecting an individual patient record from the patient match screen, which I'll show you just momentarily, users are not required to break the privacy seal in order to view the patient's HIE information. If you're familiar with our clinical portal, you know that if you search for a patient, say Chad MacLeod, and you try to click on their record, it first requires you to log your reason for doing so with an explanation. Because folks are using our new application within context of their EHR, there's no need to do so. And secondly, for patients who have opted out of the HIE. Okay, so a couple things to show here. So should the user's desired search criteria for the wanted patient correspond with an exact match within HealthInfoNet for a patient who has previously opted out of our services, there will be no record of the patient within the application, and an error message will be returned. However, if you search for Chad MacLeod, and there are 5 different Chad MacLeods that meet the demographic search criteria that you're entering, and one of those Chad MacLeods has opted out, they just simply won't appear in the patient match screen. The other patients included within the HIE that are named Chad MacLeod will appear, but the opted out one will not. So again, these are some of the things I can't necessarily show you in the demonstration, but are good background to have, and which may spur further questions going forward. So with that said, and with a little bit of background on the application under our belts, I'm going to turn to the demonstration, and just give me a moment while I switch my screen. Okay, you should now see the demonstration environment of the HINcontext application. And Nicole, if you can't see it, just call it out, but I think we should be in good shape now. So, one second. All right, super. So, as I mentioned before, from the EHR, users can conduct a demographic-based search of an individual patient. So, doing so will initiate a query within HealthInfoNet to identify all patient records in the HIE that meet the desired criteria. HealthInfoNet will then send back to the application all possible patient matches to display in the application's patient match screen, which is what you're seeing here. So if you're in Epic or Cerner or your EHR of choice, and you enter in the first name, last name, date of birth, or an MRN, for example, it will pull up within your EHR, just as I showed you on that screenshot of Epic, And at the exact same time, without any additional manual intervention needed, it will also pull up the record within the application to the right-hand side or wherever it may be configured. So within this patient match screen, individual records for each possible patient match are provided for users to review and to make the appropriate identification. Here you can see that we provide first name, last name, sex, date of birth, physical address, and then there's a match score, which is essentially the indication of how closely the original search conducted within the EHR matches the information returned by HealthInfoNet from our systems. Once users have selected the record of interest, they can essentially click on the record within that patient match screen. Now, just a little bit of orientation here. By default, it will land you within the clinical data module, and by default to the active problems tab. However, you will be able to toggle between the additional navigation on the left-hand side of the screen. Additionally, at the upper right in the upper portion of the screen, the patient's demographic information will always follow the user throughout any screen that is clicked on subsequently. So here again, you can see the patient's full name, their first and last, their sex, their date of birth, their physical address, and that matched score once again. Now, within the screen that's being showed by default, you can see the active problems for the patient. And this, again, is the information of the patient's active diagnoses. And here, the screen looks a lot similar to what you see in the clinical portal. So you've got the onset date, which is when the diagnosis was recorded by the patient's provider. You've got the ICD-10 or SNOMED code corresponding to the patient's diagnosis. You've got the ICD-10 or SNOMED description corresponding to the patient's diagnosis, as well as the facility of the provider who recorded the patient's diagnosis. Next, you have encounters. And encounters is a similar view of active problems, so simply stating what information we have about the patient's visits within our system. So here you have admission date, discharge date, the facility of the provider who saw the patient for the encounter, the type of visit, so whether it was inpatient, outpatient, emergency department, as well as the reason, which corresponds to the primary diagnosis description. After that, we've got health records. And health records is a combination of a couple things that are typically parsed out within our clinical portal. So here we see laboratory, radiology, and clinical notes. And clinical notes is a combination of all other types of documentation that is received by HealthInfoNet. By clicking on a particular filter option here, it will narrow the list of health records down just to the type of document selected. So in this case, I click laboratory, and you can see radiology, and then lastly, clinical notes. Now, if I go back to laboratory, for example, you can see that you've got the date that the document was recorded, where it was recorded from, and then a quick description or a title of the document itself. If I click into one of these records, which was different from the active problems and encounters views where there is no drillable, you select, for example, the first laboratory result. A new window pop-up will appear with additional information about it, such as the lab result comment, any observations, such as the name of the lab, the results, and the range, and then any specimens. I can do the same thing with radiology. So if I click on this first record, you can see that the radiology report, as it's provided in the format to HealthInfoNet, is displayed here again. And then lastly, we have clinical notes. And again, clinical notes is miscellaneous types of documents that don't fall into the laboratory or radiology buckets. And so if I were to click on, let's say, this Eastern Maine care plan, you can see again that it's displayed in the format that we receive it in. Now, in some cases, there is, it's important to note that there are sometimes the application cannot display a type of document that is received by HealthInfoNet due to the type of format that it is in. And that's a current limitation of the system that we are addressing. However, some of the error messages that may display, for example, is no notes available for this record. And that's not necessarily meaning that there's no additional content associated with this particular document. It may simply mean that the application is not available or able to support the document content. And so this is a nuance that is described in detail within our user materials for folks that are using the application. However, it does still point to a use case in addition to trying to access mental health information, for example, like I mentioned earlier, in logging in separately to our clinical portal. Now, in addition to the data that's contained within the clinical data module, active problems, encounters, and health records, there's finally this medication management module, which displays the information that HealthInfoNet receives for medications from both Allscripts and from Maine care claims. And so this is a combination of the two data sources that we receive for our patients, and we would display it here within this view. You've got the name of the drug, the date that it was filled, if available, the day's supply, quantity dispensed. You've got the name of the prescriber and the pharmacy name. Now, within these views, because I'm expanding this view to my full screen, but the reality is that it's maybe just a quarter of the screen within an EHR workstation, there are some tips and tricks within the application to maximize your space and real estate. And so, for example, this caret here on the right-hand portion of the screen, when clicked, will collapse the demographic view, and when clicked again, we'll expand it. So again, just to save some space. We also know that sometimes there are patients that may have a number of records within this view for the past 2 years, and so it may be difficult to find what you're looking for right off the bat, in which case you can either search a view by clicking and selecting keywords, or you can always filter the table based on the field criteria that is provided. Additionally, in this event here, because day's supply is completely null and therefore maybe not useful to the user, there's a way to change the types of columns that are displayed in the view. And so if I click the day's supply, it'll go away. And therefore, when we're thinking about the 1/4 screen real estate, that would greatly give you a little bit more room to view. So that is the totality of the application in its current state. I'm going to again pause my screen and go back to my PowerPoint. One moment. All right. And so before we wrap up today's session, I thought it would make sense to quickly take a look at our roadmap. You know, you've seen what's the current state, but what's the vision for the application and where are we going with it, and how may the additional steps we're taking become valuable to your organizations over time? And so, as I just showed you, the current release of the application that Maine Health currently has available to them includes demographic information. It includes clinical data, and specifically health records, including laboratory results, radiology reports, and other miscellaneous documents. It includes encounters. And then you have that medications component, which is a combination of Allscripts and Maine care claims data. Now, in working with CRISP, our partner down in Maryland, we do have on the roadmap to include allergies, active problems, and then additional diagnosis and procedure information within that clinical data module. And then, as I showed you when we encountered an error message upon selecting a particular document, it doesn't necessarily tell you that there may be more information and to go to the clinical portal to do so. And so in that case, we're trying to enhance some of the messaging we have around those system limitations. And then also, rather than displaying an error message, if you look up a patient that has opted out of the health information exchange, making that very clear to our end users so there's no confusion. Beyond that, we do have future releases that are currently being planned between us, DHHS, and our other partners to integrate the prescription monitoring program into the application so that users within the EHR can quickly not only access their the health information exchange clinical data, but also access the PMP medication data alongside it. And so within that realm of scope, we're looking at bringing in the controlled substance history for patients' PMP alerts that come from the PMP system itself, and then also not only just being able to view the patient's controlled substances within the state of Maine as they're prescribed, but also looking out to the interstate querying, so to look at New Hampshire, Massachusetts, Rhode Island data. In tandem with that, we are trying to look into single sign-on integration, which would allow users to, within the application, select a button and quickly move out to the clinical portal to view that same patient record to obtain that additional information when there are uses for it. And then also, as we expand and integrate with the PMP, we're having that same single sign-on integration with the broader, larger PMP platform, so that folks, if they need to prescribe or do additional information on reporting and analytics, they can quickly click a button and get that more robust data from the centralized PMP platform. So there are a couple of available resources that our participants can view if they are interested in learning more about the HINcontext application. We've mentioned it before on our webinar series, but HealthInfoNet's website has a dedicated training materials webpage, which is particularly helpful in terms of finding the types of resources to use our tools and services more efficiently. And so if you wanted to visit this particular website, it is available to the public. And there, under our HINcontext application header, you are able to find the EPIC version of our EHR HINcontext user guide. So you can thumb through it and take a look at all that it contains currently as you're potentially assessing it for your organization. Additionally, we do have a new HealthInfoNet Academy website. If you're familiar with our education, Sharon and Nicole do hands-on, in-person and online trainings, but we also have an online educational platform where users can go on and at their own leisure, take a course, in some cases receive a CNE credit for basically being able to better learn our systems and applications. And so this is, again, available to the public. You don't have to be signed up for the HINcontext application, but if you go on, you simply need to register with the site and then enroll in the new HINcontext application course. And you can see a tutorial like I just gave today, and you can pause and review as you'd like. Now, for next steps, there's a lot of people on the call today that don't fall into the Maine Health Covenant or Northern Light organizations who we're already having conversations with. So it's worth mentioning that if this sounds of interest to you and your organization, as I mentioned earlier, the application is currently developed to be integrated with Epic and Cerner EHR technologies, but we do have priorities to work on the Allscripts and Athena technologies moving forward. And so as we have those prepared, we'll certainly let our participants know that it becomes available so that we can begin some of those conversations that may otherwise be paused at the time. And so if folks on the call have questions and they want to connect with us, we do ask that you contact our customer support team at customercare@HinfoNet.org. Just quickly send them a quick note that say you're interested in this. They'll connect you with myself and our clinical educators, and we can have that initial conversation in terms of what a project plan may look like, how to coordinate details, and so on and so forth. And so I said it at the beginning, but I'll say it again, a quick plug for our clinical education team who do a really great work with working with our participants and their end users and making sure that they're comfortable and knowledgeable of our tools and services. So I mentioned Nicole earlier, she's manning the chat. So Nicole is a clinical educator, so is Sharon Bearer, and the two of them work great together. If you have any questions about anything that you heard today or any other HealthInfoNet services, we'd love to hear from you, any feedback that you have to continuously inform our solutions. So again, if it's a Zoom meeting nowadays, feel free to reach out to them. They can schedule one at your convenience. I mentioned that special resource webpage on our online website. And then lastly, we have our new HealthInfoNet Academy site, which is totally redesigned. It has much more information than it did traditionally. So I hope that finds you all well and is useful to you in your work. So with that said, looks like I was able to fill that all up in 30 minutes. So I want to thank you all for attending today's session, for us to preview and to show you all of the work that we've been doing with our partner CRISP over the last 6 months, taking into consideration a lot of feedback we've heard over all of time about trying to make our solutions more embedded within our participants' EHR and clinical workflows. And I hope that this is a good start, and the roadmap ahead provides a vision for where we're going. So I'm going to stay on the line for as much time as we need. Again, if there are facility-specific questions, feel free to reach out to us separately if you'd like. But if there are general questions, we can take those now. I see the chat window filling up, so I'll look at that in a moment. And otherwise, I can give folks back 30 minutes of their day. So again, thank you all for attending, and we'll hang tight in case there are questions.
Yeah, Chad, we just have a couple of questions I wanted to address with the group. So we did have one question. How are the HIN accounts of providers being adjusted as the early adopters?
Yes, that is a great idea. Great question, rather. So for Maine Health, for example, I'll just use them as an example. How it works is we are working with their physician users right now is kind of a soft release of the application, essentially making sure that it's configured appropriately, it's giving them the value that they need. And then from Maine Health's perspective, it is being rolled out to additional nurses, clinical support staff, QA analysts, and we've heard from their informatics team that that should be happening around August or early September or so. And so I'd advise, if for Maine Health specific users on the line, if you don't already have availability to this, reach out to your help desk or IT team and ask about it. That would be a good first start. And generally for new organizations, that's the approach we're taking as well. Try to limit the number of users that are using the application in the first couple of weeks of its adoption. Make sure that it's working appropriately, and then expanding it as we go.
Great. And then the second question was, for those folks using Epic, are they limited to 2 years of clinical data?
So I'll answer this in a couple ways and see if it answers the question. So my understanding for Maine Health, again, for example, and I think this is common for most platforms, is there's a way to, from your EHR, to click on a button that will bring you out to a separate browser tab to log into our clinical portal. And from there, that's where our entire HIE history will be contained for the patients that we have data for. And so there's no limitations within the clinical portal. It's only if the application is configured, the HINcontext application is configured within the EHR itself, that there becomes a limitation in the HIE data that's being presented within the application only. And that's where there's that 2-year look back due to performance issues. We want to make sure that it's as fast as possible and it doesn't take a lot of time to load.
Great. Those are the two big ones in the chat. So I don't know if folks have other questions. They can certainly type, or if they want to unmute themselves and ask. As Chad said, we can hang out for a little bit to address any of those.
Okay, hearing no further questions or seeing no further questions in the chat window, I think we'll end today's webinar, give you all back about 20 minutes of your day to go grab some lunch. And again, if you have any questions, feel free to reach out to me directly or to the customer care at hinfonet.org email address. Thanks, everyone. Bye-bye.